Hello friends, welcome back to my channel Medicine of 101. Today we will talk about the vomiting in pregnancy. It's one of the important topic, as you know, that most of the women, those who are pregnant, will get to see the vomiting right in the early stage of the pregnancy. Now see why we'll see the vomiting in terms of the pregnant woman. Now see whenever we'll get to see the proper implantations of the embryo along with the endometriums, or whenever we'll get to see the proper attachment of the embryo along with the endometriums of the uterus, and we'll get to see the development of the syncytotrophoblast, trophoblast, syncytotrophoblast, and syncytotrophoblast that release one kind of the hormone that is known as HCG, human chorionic gonadotropin, and that causes the vomiting, right? So we can write it over here, the vomiting in pregnancy. So let's write it over here. Because of the proper implantations, right? And we'll get to see the development of what? As I said, syncytotrophoblast, syncytotrophoblast. Now see, in these cases, basically we get to see the releasing of the hormone. Now the vomiting in the pregnancy, that is also known as what? Morning sickness. So it is also known as morning sickness. But see, the term is morning sickness, but that means what? That means from the term we are understanding that the vomiting you will get to see in the morning time, but not, it's not true, right? It can happen anytime. It can happen anytime. Now, what are the etiologies for it? So what are the causes that will cause the vomiting? Now vomiting that will be seen because of the hormonal changes. As I said, we'll get to see from here the releasing of the HCG, human chorionic gonadotropin, that will be released more. We'll get to see the the value for estrogen, that will be also more. The value for progesterone, that will also more. The secretion of the leptin, that will be more. And we can also say that the different kinds of the placental growth hormones, the secretions of the placental growth hormone, placental growth hormone. Now see, placental growth hormone, whenever we will get to see the more secreted, will be in more amount. Not only the HCG, yes, HCG is one of the major reason of course, but the other hormonal changes are also responsible for causing the vomiting in pregnancy, right? Now see, these are the causes that can cause the vomiting, right? And apart from that, there are some environmental factors and the psychological factor, right? There are some environmental factor and psychological factors. So we can see over here, there are some environmental and psychological factors. Environmental and psychological factor. Psychological factors that are responsible for causing the vomiting. Now see, in a woman, if in a pregnant woman, if we get to see that severe vomiting, for example, if we get to see the severe vomiting, so if I write it over here, in a pregnant woman, if we get to see that severe vomiting, if we get to see what are the conditions over here, the first thing, severe vomiting. Severe vomiting. If we get to see that unrelenting nausea, unrelenting nausea, and if we get to see, for example, severe vomiting, unrelenting what did I say, nausea, and if we get to see that the individual is not intended to have the foods or liquids, or the solid food or the liquid, so almost no food in terms of the solid or liquid food, okay, and liquid. Now this is the condition that is known as hyperemesis. Okay, let me use this color for it. So these conditions together known as hyperemesis, 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 gravidarum, gravidarum. So what did I say? The important thing is over here. In a pregnant woman, if you get to see, that the severe vomiting, if we get to see the severe vomiting, unrelenting nausea, and almost no food and liquids, So whatever thing we'll get to see, these three combinations together they are known as hyperemesis gravidarum. So what did I say? Hyperemesis gravidarum, that is defined by in a pregnant woman who is having what, the severe vomiting, unrelenting nausea, and she is not intended to have any kind of the food or liquid. Okay, so these three things together they are known as hyperemesis gravidarum, right? Now what are the clinical features we'll get to see in these cases? Right, see, so this will write it over here. So what are the features we'll get from here in these cases? Now see, whenever we're getting that severe vomiting, for example, we'll get the dehydrations. Whenever the individual will not intend to have the food, as a result we'll get to see the weight loss. So we'll get to see dehydrations. It's not working. So we'll get to see dehydration. We'll get to see another thing, this is the weight loss. Now and see another important thing. So whenever we are getting to see the vomiting, as a result we'll get to see from the stomach. From the stomach, we can say the H plus that will come out, and whenever the H plus or the proton that will come out, so the concentrations of the proton, the outside it will be more, inside the value for the proton that will be less. As a result, we'll get to see what? Okay, so we'll get to see the alkalosis, right? So the HCl that will come out. So within the stomach, the HCl, what? That will be less. HCl that will be less. As a result, we will get to see the alkalosis. Along with that, the potassium, along with what? Along with this, the potassium that will also come out. So whenever the potassium that will come out, as a result, we will get to see what? As a result, we will get to see the hypokalemia. We will get to see hypokalemia. Hypokalemia. Now see the other reasons for it. The other features we will get to see over here, the alkalosis, weight loss, dehydrations, right? And another important thing, for example, over here, that is, wait a minute. Same thing, but I am writing it over here. That is known as hypochloremia. This is also known as what? Hypochloremia. For example, chloremia. That means the HCl that will be less as it is coming outside the body, right? And one of the most important features we'll get to see over here, that is what? Starvation ketosis. Now what did I say from this term? See, whenever the pregnant woman, for example, so over here, she is vomiting and she is not intending to have any kind of the food. She is not interested in having the foods. So whatever the features we'll get to see. So whenever there will be the no food, as a result, okay, whenever she is not taking any kind of the food, we'll get to see that weight loss. For the vomiting, we'll get the dehydrations. As the the H plus that is going outside, so we'll get to see the alkalosis, right? Along with that, whatever the thing we'll get to see. Along with the proton, the potassium that is also coming out, so we'll get the hypokalemia. Along with that, we'll get to see the starvation ketosis. As the woman, so the pregnant woman, she is not taking any kind of the food, so just to survive, just for her survival purpose, the body that will start breaking down. The body will start breaking down of fat, right? So during starving conditions, right? See, in these cases, we'll get to see during starvations, the body that will start breaking down of fat. Now, whenever the fat that will be broken down, we'll get to see the formation of the ketone bodies, right? And these ketone bodies that will supply the energies to the woman. But these ketone bodies that are not good for the fetus. So not good for fetus. So this type of problem we'll get to see. We'll get to see the dehydrations. We'll get to see the alkalosis. As the proton that will go out, as a result we'll get to see what the alkalosis, along with the proton, the potassium that will also go out. So we'll get to see the development of hypokalemia, right? And as the woman, she is not taking any kind of the food, so we'll get to see the starvation ketosis, right? The fat of the body that will start breaking down. So we'll get to see the formations of the ketone bodies. These ketone bodies that will supply the energy to the woman, but these ketone bodies are not good for the fetus, right? So remember these things. Okay. Now, in these cases, we can give, the body for just to manage this condition, we can use some dextrose or glucose. Dextrose we can use. So whenever we will give the dextrose, see, this dextrose that will be utilized by the body, right? And it will produce, the body will produce energy from the dextrose. So there will be no usings of the ketone bodies over here. Okay? Because whenever, see, the more ketone bodies, whenever the ketone bodies, that will be more. So more ketone bodies, that will cause the more vomiting. This is the cycle. And more vomiting, that will cause the more, that will, that will stimulate the body to form the more amount of the ketone bodies. That's the most important thing over here, right? So these are the clinical features we'll get in terms of the vomiting. Now, another important thing, see, the vomiting can be seen for not only for pregnancy. What did I say? The vomiting can not only be seen. The vomiting can not only be seen for pregnancy. The vomiting that can also be seen for other regions. So we have to rule out the other regions that can cause the vomiting. So we have to rule out. So we have to rule out gastroenteritis. We have to rule out pancreatitis, for example, acute pancreatitis. We have to rule out acute cholecystitis. We have to rule out peptic ulcer disease. Okay. We have to rule out hepatitis, for example. So, in the early pregnancy, as we know, that we'll get to see the vomiting. But the vomiting that can also be seen due to gastroenteritis. The vomiting that can also be seen for the pancreatitis, for acute cholecystitis, for peptic ulcer disease, and also for hepatitis. So we have to rule out these regions. And in late pregnancy, right? So this is in early pregnancy. We have to rule out these things from over here, right? In late pregnancy, okay. Late in pregnancy, I should write late in pregnancy, we have to rule out the preeclampsia, preeclampic toxemia, preeclampic toxemia, fatty liver. So we have to rule out these things late in pregnancy, because in the late in pregnancy we can also get to see the vomitings. So just to confirm, that is the vomiting that is for only for the pregnancy, pregnant regions. So we have to rule out the other regions, that is the preeclamptic toxemia. We have to rule out also the fatty liver from here. Now we'll talk about okay. So what are the complications we can get over here? What are the complications we can get from here, right? So before going to the complications, let's define one more thing over here. That from here we can get to see some vitamin deficiency. We can get to see some vitamin deficiency, right? So what type of vitamin deficiency we can get from here as a result of the severe vomiting? Wait a minute. So first we'll get, in terms of the vitamin deficiency, we'll get vitamin K deficiency. Vitamin K deficiency. So whenever the vitamin K that will be deficient, as a result, what type of thing we'll get to see? Hypoprothrombinemia. Hypoprothrombinemia. So in these cases, we'll get to see that hypoprothrombinemia. Hypoprothrombinemia. Okay. We'll get to see also the deficiency of the vitamin B1. So we'll get to see the vitamin B1. So that means the thiamine deficiency, right? Okay. Now, apart from that, see, whenever we'll get to see, sorry, let's continue. Whenever we'll get to see the vitamin B1 deficiency, vitamin B1 deficiency, we'll get to see that is known as ornic encephalopathy. Ornic encephalopathy. Now, whenever we'll get to see the deficiency of the vitamin B1 or thiamine, in these cases, we'll get to see the ornic encephalopathy. Now, ornic encephalopathy will get a triad. What is this triad? We'll get to see that what? Ophthalmoplegia. So, we'll get the problem in the eye. Ophthalmoplegia. We'll get to see. See, what did I say? Just repeat it once again. So in these cases, we can get to see the vitamin deficiency in terms of the vitamin K and vitamin B1. So whenever we get to see the vitamin K deficiency, we get to see that formation of hypoprothrombinemia, and whenever we get to see the deficiency of the vitamin B1, in terms of the vitamin B1, we get to see the wrinkle. Anyway, so just remember in this way, Orankin encephalopathy. Oinic, yes. Oinic encephalopathy, you can say oinic encephalopathy. In these cases, we'll get to see the triad, we'll get the ophthalmoplegia, we'll get the confusions, and another one is the ataxia. So another thing we'll get over here, that is the ataxia. So these are the triads we'll get in terms of the vitamin deficiency. So what did I say? We'll get to see the deficiency of the vitamin K. In terms of the vitamin K, we'll get to see that hypoprothrombinemia. In terms of the vitamin B1, we'll get wrinkle encephalopathy and oinic. In oinic encephalopathy, we'll get a triad, we'll get the ophthalmoplegia, we'll get the confusions, we'll get the ataxia, right? So these are the things we'll get for the vitamin deficiency. Now let's go to the complications. So what are the complications we'll get to see over here? So let's erase some part from here, then let's continue after that. So from here, let's go to the complications part. See, so in terms of the complications, so what are the things we'll get in terms of the complications? First, see, so whenever we are getting the severe vomiting, try to understand whenever we are getting the severe vomiting. So the uses of the lower esophageal sphincter, that will be much more. If we talk about in terms of the diaphragm, diaphragm regions from here, so that will be also utilized more, right? Up and down. So in these cases, we can get to see the esophageal tear. We'll get to see the complications, esophageal tear. So within the esophageal tear, the most common one we can get to see in terms of the what? Boerhaave. Okay, we can get to see the esophageal tear, we can get to see the diaphragmatic tear over here. So we can get to see the diaphragmatic tear also for it, right? So whatever the things we'll get to see in these cases, okay, we'll get to see mallory waist tear also. Now another thing we'll get to see for the vomiting, that is mallory waist tear, of course, from here. Now see, and we can get to see also sometimes the depressions, because she is not able to take the foods, and she is thinking that how my baby will get survived. So for that reason, she can be in the depression also. So what are the complications we'll get? So first we'll get the esophageal tear. Within the esophageal tear, we'll get to see the Boerhaave Okay, we can get to see the diaphragmatic tear, we can get to see the mallory waist tear also, and we can get to see also the depressions. So these are the complications of the vomiting in pregnancy, right? In severe vomiting in the pregnancy. And another important thing is over here, you can remember that whenever try to understand, whenever the during the vomiting conditions, the body, what the body fluid level that will be reduced. So what did I say? During vomiting, the body fluid level that will be reduced, so within the kidney the perfusion that will be also less. As a result, we can get to see the acute tubular necrosis, right? So for that thing we can get to see in these cases that acute kidney injury. So in these cases we can also get another complications, that acute kidney injury. So these are the complications we'll get in terms of the vomiting in pregnancy, right? Esophageal tear, as I said, malarious tear over here, and we can get to see also the acute tubular necrosis in terms of the nephron. That is nothing but the acute kidney injury, right? Okay, now let's go back to the treatment part. So what type of the treatment we can get over here? So the treatment we can divide in three parts: the mild vomiting, moderate vomiting, and severe vomiting, right? So let's talk about the treatment part. Okay, so let's talk about the treatment part. So what are the treatment we can use in these cases? Now see, in terms of the treatment we can classify the different conditions. The mild vomiting. So in mild vomiting, what type of thing we can use? So first we should suggest the individuals for the diet, because if she is overeating, if she is she is just eating from the up to the neck, for example. So in that conditions we can get to see the vomiting that will be frequently. Now in these cases we should suggest the patients, or we should advise the patients for having, or just to look after the what diet. So in these cases we'll say the patients or the individuals over here for small frequent diet, frequent diet, small frequent diet. For example, we can suggest the individuals to have the biscuits in the morning, okay, before on empty stomach. So we can just suggest the patients okay, for having the biscuits in the morning on empty stomach. Okay, and we can just suggest for the diet first. Okay, and of course we can use the drugs also. Okay, for a drug in terms of the mild vomiting, we can use doxylamine plus vitamin B6 pyridoxines, right? So what is the drug we can use over here? Doxylamine plus vitamin B6, that is nothing but the pyridoxines. Okay, so what type of drugs we can use over here? So in terms of the mild vomiting, what did I say? In terms of the mild vomiting, we should suggest the individuals for for having the diet properly. I mean in terms of the small frequent diet, right? So you can have the biscuits in the early morning, okay, on the empty stomach. And as far as the drugs are concerned, we can use the combination of doxylamine and vitamin B6, that is nothing but the pyridoxine, right? In terms of the mild vomiting. Alright, let's go back to the moderate vomiting. So what are the conditions we'll get to see in terms of the moderate vomiting? Wait 1 minute, let's erase this part. Okay. So in terms of the moderate vomiting, what are the conditions we'll get? We'll get the vomiting that will be frequently. So we can say over here in moderate vomiting. In moderate vomiting, what are the drug we can use over here? And see, in these cases we basically have to go with the drugs. So first we can use the prochlormethazine, prochlormethazine. Let's write it clearly. So okay, zine, it will be prochlormethazine. See, we can go for the prochlormethazine. We can go for that one drug that is, all of you know it. That's the ondansetron. So ondansetron we can use through the rectal route also. Sometimes by giving the the oral or intravenous it is not working. So sometimes we can use that ondansetron. Ondansetron. So ondansetron we can use the prochlormethazine. Sorry, it will be prochlorparagen. It will be prochlorparagen. I was also thinking. So it will be prochlorparagens, and it will be another is the promethazine. Prochlor. What did I say? Prochlorparagen. I was also a little confused about this one. So prochlorparagen we can use yes, now it's correct. We can use promethazine. Alright. So we can use prochlorparagen, we can use the promethazine, we can use the ondansetron through the rectal route also. Through rectal route we can also use the ondansetron over here. Another one you can use metoclopramide. Yes. So we can use these drugs in terms of the moderate vomiting. So in terms of the moderate vomiting, what did I say? We have to go with the drugs. We can use that prochlorparagens, we can use promethazine, or we can use metoclopramide. And ondansetron, of course, we can use. Sometimes we can use also through the rectal route as well. Now we'll go to that severe vomiting. In terms of the severe vomiting, what are the things we can use? Now see, in severe vomiting, so at first we have to make sure that yes, that we are supplying the intravenous hydration, right? Because the body fluid volume that will be too much less in these conditions, right? So we have to go for intravenous hydration. So you can use that intravenous normal saline, or you can use the Ringal lactate solutions. Alright, in these cases we can use the intravenous hydration. In terms of the severe vomiting, we have to go for the intravenous hydration. In terms of intravenous hydration, you can use that normal saline, or you can also use that or Ringal lactate solutions. Okay, along with that, we have to inject intravenous. We have to use this drugs only. Intravenous prochlor. Okay, we have to use intravenous prochlorparagen. We can use intravenous promethazine, or you can use intravenous metoclopramide. So in terms of the severe vomiting, we can go for the intravenous hydrations. In terms of intravenous hydration, you can use the normal saline. You can also use that Ringal lactate solutions. Apart from that, in terms of the drugs, we have to inject. So here we have to give the intravenous prochlorparagens. We have to use that intravenous promethazine. We have to give the intravenous metoclopramide. Okay. Now there is another conditions, right? That is known as intractable or intractable